Hey, girlfriends. Today I want to talk to you about something that I really don't want to share. And when I found out about it myself, my heart was broken. As you know, it's Breast Cancer Awareness Month, and I've done a lot of videos and couch talks and podcasts on breast health and optimization, on decreasing inflammation in our body, on testing thermography versus mammography. And the list goes on. A couple years ago, when I first came to Dallas in the studio I was recording, I interviewed a beautiful young woman who was diagnosed with breast cancer at age 24 years old. Age 24 years old. She had a family history and positive genetics for the BRCA gene, BRCA1 gene. And she had gone through radiation therapy, chemotherapy. And when I had seen her, she was in remission. She had been free, cancer free. And that was you know, where she was at in her life. And she in this episode, we talk about the Breasties, the organization that she'd become very passionate about helping other young women with breast cancer. I found out just recently that on April 13, 2022, Sierra passed away. And this is, her name is, I mean, just this beautiful woman, Sierra Stong, and she was a strong woman. She passed away on April 13, 2022. She had been studying to be a nurse practitioner. Her love was to give back to others so they didn't struggle, and was really passionate about getting the word out for breast health and to understand what's happening with your body. And again, how can we prevent and help others? Her breast cancer was one of the mystical kinds, one of the rarer kinds, but triple node negative. And so that means it was estrogen receptor negative, progesterone receptor negative, HER2 new receptor negative, but she was BRCA genetic positive. These are harder cancers to treat. I am dedicating this month, this episode of the Girlfriend Doctor Show to Sierra and women like her who have had a diagnosis of breast cancer and are doing everything they can to thrive and to love and to understand what is their next right step. I get angry about this topic. I get infuriated at industry and chemicals and the approach to treat, and I mean, just to address the symptoms, address the final diagnosis, and never get to the root cause. Sierra's root cause, I mean, beyond BRCA1, there are inciting agents, right? What was root cause? What triggered that? What enabled the expression of that gene? And then for it to come back and in full-blown stage 4 cancer at her young age. My heart breaks for her, and I think there are several things that I write about, I talk about, and I want everyone to take to heart is number one, that that what we do for ourselves, we empower and heal ourselves, empowers the people around us. Prioritizing yourself, getting to the answers, if instinctively taking your one next right step at a time, and to not accept we just don't know for an answer, or there is no cause. I think we know now in industry in the United States that we have over 50,000 new chemicals in the last 50 years that have been infiltrated into our systems. And that gets into us. What's in our water supply from the medicine people take? How is that affecting our water supply and the health of our generations? We are not the healthiest nation in the world. In fact, we are one of the sickest nations. And I get angry at industry. I get angry at birth control, the progestins. That gets into, that it can increase our risk of breast cancer and affect hormonal imbalance issues, as well as we are excreting urinary metabolites, synthetic hormone metabolites. And what is that doing to, I mean, it's not all filtered out of our water filtration systems. So becoming really aware, we want clean water. We deserve clean water, clean air, clean environments, and we deserve to be chemical free. Our food cannot be sprayed with glyphosate and other chemicals. We have to recognize the sugars in our food and the Franken foods that are being fed to our kids at school. I mean, this has to stop. And it comes to awareness. The little steps that we can make on an individual basis can make a difference, can make a difference. It won't bring Sierra back to life. It won't bring, it may not prevent someone else's cancer from recurring. But I tell you, we can improve the health of our individual and improve the health of the generations that come, remove endocrine disruptors and toxic chemicals to the best of our ability from our system and that of our next generations, our children. I encourage each and every one of you to do a thermography. To get a thermography, it's a different look than a mammography, than a mammogram. I mean, talk with your doctor about your mammogram schedule, but add in a thermography for yourself. Add in, and if you need an ultrasound, do your breast exams every month. Do your breast exams. Choose a day. Maybe it's your birthday. I'm the 28th of July, so 28th of each month. Circle that on your calendar, set an alarm in your phone, do your breast exam. Your fingers have memory. Even if you don't know exactly what you're feeling, your fingers have memory and you will be able to detect a sensation. This doesn't feel right. I had patients in my practice whose husbands found their breast mass and would come in and say, yeah, I taught him how to do a breast exam, or we were playing around and he felt something different. So teach your partner, can playtime and be very therapeutic too. And also doing things to empower your breast health. In hormone balancing, we know there are key nutrients that help with breast. Number one, gamma-linolenic acid. You can do it from borage seed oil or blackcurrant oil or evening primrose oil. Very beneficial. Calcium D-glucarate, another one. And diindol methane from cruciferous vegetables, and it's a key component. And also just healthy keto-green, right? Keto-green, decreasing inflammation, intermittent fasting, give your body time to heal itself and to kill off unhealthy cells. And so at the inkling of something going wrong, that's a time for fasting and prayer. In my book, that is what I do anyway. And that's why I incorporate it into my programs too. A couple other things that I wanted to share with you. My dear friend Magdalena Wojlacki has created this something called Breasties, and it is meet your new breast friends, called Happy Sisters. And it is a supplement, especially if you have estrogen dominance and fibrocystic breast disease. There's this lovely topical cream you can massage into your breast, and it is getting rave reviews. It is getting rave reviews. I love the ingredients that are in it. And the Magdalena Wojlacki, she's an herbalist, and she doesn't do anything halfway. She really has put her herbalistic hat, her nutrition hat, and her all her research into this product and testing it with herself and her clients. And it has aloe, has olive oil, has borage seed oil, black cumin seed oil, castor seed oil, and I mean, and many more. But it is designed to really help with those sensitive breast tissue and estrogen dominance and fibrocystic breast. If you guys have that is underlying inflammation in the breast, and it puts us at risk. So get to know your breast, do your breast exam, massage them like you would any other part. And if you go into Europe, they're going to do a breast massage when you get a massage. We avoid that in the US. Do it yourself, right? Do your own breast exam, breast massage, light to deep touch, and feel the temperature changes. Because when there are hot spots, that's inflammation. And any inflammation in our body, unless it's addressing an acute cut, acute something, it's definitely not good for the long haul. So in honor of Sierra, I am just passionate about donating again to the Breasties, donating to women in crisis, as that is my heart. and helping support education. I ask that you do the same. Check out breasties.org. Check out this podcast, and I thank you for being part of the Girlfriend Doctor community and taking your health as a priority. And whatever your diagnosis is, remember, your diagnosis is not your destiny. Your diagnosis is not your destiny. We can change that. And your prescription is not your description. I am here for you, and I love being your Girlfriend Doctor. Take a listen to this interview.
Girl, you've got questions. Questions about your body and how to feel good in it, about your hormones and how to keep them in check. Questions about your sex life and your whole health. Can you imagine having a best girlfriend who was also a triple board certified OBGYN? A girlfriend doctor you could call and ask or tell her anything. Someone who could show you how to live any stage of life, before, during, or after menopause, in a big, bold, and beautiful way. Well, friends, I'm your Girlfriend Doctor. I believe you are meant to flourish and shine, to embrace life and awaken to all its possibilities. Let's get there together. Welcome to our show. Welcome back to the Girlfriend Doctor. I am thrilled to be here with you all again today. I am loving our shows. I'm loving our interactions. I'm loving your questions. And I want to thank you for writing in. We have been getting so many questions about breast health. You know, October is always Breast Health Awareness Month, as I like to call it. And we focused on breast health. In our first episode, we had a great deep dive conversation with Dr. Veronique Dussaulnier, who is the breast cancer conqueror, had conquered breast cancer and even wrote a book about it. I mean, great conversation, including what you need to know about your breast self-exam. So after that, our last episode, we talked about droopy breast and what do we need to do about it? How can we keep our breast healthy? What are proactive exercises we can do? And what about, you know, sexy breast wear, and whether we've had breast surgery, mastectomy or not. And we have received so many questions from our audience about breast health. And especially this question has come up over and over again. So let's go to our caller.
Hello, Dr. Anna Cabeca. I'm a huge fan of the show. Thank you so much for this topic because I've had my breast implants for over a decade now. I'm 46 years old, and I'm wondering, could my implants be making me sick? I've heard some perhaps myths that they need to be changed out every decade or so, and I'm about at that mark. So I'm just wondering, could they be making me sick? Could my implants be making me sick? Thank you so much.
It's such an important question, and you're not alone in that question and wondering, oh my gosh, you know, before all this issue with breast implant illness has come up, I've had breast implants, and now what do I do about it? What do I believe? What don't I believe? So we're going to do a deep dive into breast reconstruction, implant, and explant. I've got amazing guests to share with you today. I also have a special mission project, and this is the breasties.org. It is a sisterhood for women who have had a diagnosis of breast cancer, all ages, and a really important topic near and dear to my heart. So I look forward to sharing her expertise with you as well. So let's get started, shall we? Here we go, to the couch. Well, welcome. I am on the couch to talk with one of my dearest girlfriends, Dr. Kyrin Dunston. Her and I go way back to our early OBGYN practices in Southeast Georgia and have just run this amazing parallel route in our lives. She is now a amazing integrative, internationally renowned OBGYN doing online health and wellness, focusing right now in the midst of her menopause summit. So, hey, Kyrin, how are you? Welcome.
I'm doing great. How are you, Anna? So glad to be here.
Glad to have you. Glad to have you. You know, today's discussion, we've been talking about breast health and breast cancer recovery and implants and explants. And you have shared your personal journey with me on this topic, and I would love for you, and I really thank you for sharing it with our audience. Having this conversation is important. So talking about your experience with breast implant illness.
Yeah, it really is important. I came to breast implants late in life after I lost 100 pounds. I was previously a C, and I know there's no such thing in your world as TMI, so I just tell it like it is. I was previously a C cup, but then I lost 100 pounds, and I was down to an A, just because I had actually a breast reduction when I was obese, because I had so much neck and shoulder and back pain. Didn't know at that time that I had fibromyalgia, but I did. Then after I healed myself from that and I lost all that weight, I had no breasts and I didn't feel like myself. And so I had implants placed. Big mistake. I did okay for a while, but then at some point I started having health problems, and my health had been the best of my life. And so when I did, I consulted an environmental doctor, actually Dr. William Ray right there in Dallas. And he actually immediately said, I think it's the implants. And he tested me for sensitivity to silicone. And so kind of right there is when I made the decision to have them out.
So, and I know you, I've known you through this journey. I know you at your peak of your health. I mean, running a practice and a med spa and all of these great things you're doing to help women and families. And then all of a sudden it was like one illness after the other, and it was chemical sensitivities you were experiencing, the brain fog issues. And it was like, okay, I'm almost a feeling of disorientation. Would you agree?
Yeah, it was hard to decipher which was the breast implants and which was the environment, because I actually started working in a building that was new and had a lot of varnish and VOCs in it. And so we thought it was completely the building that made me sick. So the symptoms I was having was swelling in my hands and a disorientation, lack of balance, pain in the body, fatigue. And then from the building, I think a lot of upper respiratory symptoms, nasal drainage, things like that. And so that's when I went to Dr. Ray, who really is one of the fathers of environmental medicine. And he said, yeah, the building is the acute issue, but also the low burning, slow burning issue is this silicone that's in your body, that really is, even though it's encapsulated, the capsule itself is made of silicone, and it does seep out into the tissues and cause a reaction. So the symptoms, were pretty classic for breast implant illness, a lot of them. And then superimposed on top was this building illness. So I kind of had two issues going on.
And so when he tested you for silicone, was that a blood test? How did he test you?
Great question. So he did skin testing for various environmental allergens by injecting them under the skin, and then they would measure the reaction over time. And so with the silicone, I had big reactions to some building things like the VOCs from the varnish, and then also from the silicone. I had a reaction, and that's when he said, I really think this is a big part of it. And I actually didn't have an explantation for probably about till a year after that, to really work on detoxing my body to get all of the VOCs out and formaldehyde from the building. And so it was about a year later that I had it.
And then when you had the explant surgery, talk about that journey and what that was like, and what did they find when they removed your breast implants?
Sure. So it's interesting, a lot of plastic surgeons aren't really on board, shall we say, with this fact that silicone implants cause health problems, even though it's documented by the FDA that there's an increase in certain type of lymphoma and autoimmune disorders and connective tissue disorders. And in many studies that put them in, that I wanted them out. He looked at me and said, well, why do you want to do that? Why would you want to do that? And so I explained to him about the environmental problems, and he kind of rolled his eyes and said, yeah, well, whatever, I'll take them out if you want me to, which was kind of interesting, because I think that women who don't necessarily haven't seen an environmental doctor, and nobody's really confirmed that this is what's going on and this could be the cause of your problems, and don't have that validation and affirmation behind them, their plastic surgeon might just dismiss them and convince them that it's not a part of the problem. So he said, fine, I'll take them out but I don't really think that's the problem, is what he said. And so it's a pretty simple procedure to have them removed. And just like having them placed, it's not the surgery of the placement that's the risk. It's actually that you're putting this foreign toxic body in your body. That's the risk. And it increases the longer you've had the implants. So the surgery wasn't that bad, some bruising and discomfort, but that'll probably only lasted a few weeks. And then it's interesting, though, I really did notice within a few weeks differences, especially in the brain fog and the fatigue and that balance issue I was having and the swelling that I was having. So, and it's, I know some people when they have explantation, they notice it immediately, they feel better, like almost like taking the trash that's been sitting in your house and getting it out of your house. Mine wasn't immediate. It took a few weeks, and then it gradually improved over months. So I really do think that it was the best decision.
Awesome. I want to thank you for sharing that with us, because I know I see you at your peak right now. So, you've done a lot of work, and you're just, a detective. We say the Nancy Drew. Get your Nancy Drew on, always detective, looking for those root causes and walking your talk. So I want to thank you for all that you share and all that you do and all that you give the world. And so if a woman's wondering whether or not they have this, this implant illness, and where do you recommend testing? What resource do you recommend them going to?
I think consulting with an environmental physician is the best option, because they're really trained in the science of what in your environment is making your body toxic. And that includes the environment inside your skin. And Dr. Ray has since passed away, unfortunately, but he does have doctors at his practice who consult. And there's an organization of environmental doctors that can really look at this, and they can test you for sensitivity to silicone and see how you react. So that would be what I would recommend. But also most functional medicine, metabolic specialists like I'm trained in, can know that this is a problem. I had a patient come to me, she was about 28, and she had breast implants placed a few years prior, and she was having all kinds of symptoms like we're talking about. So she was having pain, she was having these chronic headaches. Her memory really had decreased, her short-term memory, even in her 20s. And she had been from doctor to doctor to doctor, which is the common symptom that you find in addition to the breast implant illness symptoms. People say, I've been from doctor to doctor to doctor, and they tell me that they can't find anything wrong, nothing's wrong, because this isn't going to show up on your regular lab test, your CBC, your blood counts, your chem panels, right? It takes a lot until those are actually going to be disrupted. And so they'd say, you're fine. And she'd say, well, I'm not fine. I'm 28. I feel like I'm 60. She was having joint pain also and muscle pain. And so she really wasn't getting answers. And then she found me, and on our first interview together, I said to her, she told me she had breast implants. I'm like, well, that's where we got to look first. So it really should be the first place that any doctor looks. And so if you're having symptoms that you think could be due to implant illness, you need to tell your doctor that you have implants right away, because I find that some women don't offer that information on the initial health history for whatever reason. Maybe they consider it cosmetic. It's not part of their medical history, but it really is, and it's that important. And then if they don't talk to you about breast implant illness, then you need to find a doctor who knows about it. So actually this young woman, 28, that was one of the first things we looked at and addressed, and she had them out. And she was one who her symptoms decreased immediately after her surgery. So, it's a shame that she had to go on that long journey of seeking, because really the information is in the literature, and there's awareness of it with the FDA. And so most doctors should be versed in this. Unfortunately, they're not.
Yeah, no, this is why we're bringing it to awareness. So that just to ask the question, well, what if, or if it could be, what do we need to do to address it, and how do we get to the bottom of it so that we can heal and move on, right? And I think too, women have a tremendous amount of intuition. So if you're thinking about it, let's, get it checked. Let's get it checked and see. And our plastic surgeon, Dr. Rachel, who was just on recently, she said, part of routine surveillance with breast implants is ultrasound every 3 years, even to look with ultrasound. I think that's a great step in the right direction to say, okay, it's not just, once and done, right? In and done. We need to, it's like maintenance, like anything else. Kyrin, it's great being with you. Thank you for spending time with me this morning and having this discussion. That's so important to have. I know you've got a busy schedule and you've got your menopause summit going strong. So
yes.
Thank you. We'll chat more later. I look forward to it.
Yes. Thank you so much for having me.
Welcome back. I'm so excited to have Sierra Haley. She is a 26-year-old stage 3 triple negative breast cancer survivor. Yes, you heard that right. 26 years old. She works as a registered nurse in Dallas, Texas, and she's a co-ambassador of the local Dallas-Fort Worth chapter of an amazing organization called the Breasties, which is a nonprofit organization dedicated to supporting those affected by breast and other reproductive cancers through community and friendship and openness, right? So we're having a great conversation. Welcome, Sierra. Welcome to the Girlfriend Doctor Show.
Thank you. Thank you, Dr. Anna. It's great to be here.
Well, I want to thank you for coming and also for being so open. I think that's what you said. You joined the Breasties because people aren't afraid to talk about anything.
Yes. So when you're diagnosed with breast cancer so young, it's just you ultimately feel alone. And the mission of the Breasties is that no one feels alone. So when I discovered them, I met another young breast cancer survivor in the treatment center where I was at. And through Instagram, I found the Breasties. And so it's been great. They're willing to talk about the things that people don't want to talk about, sexual health, which is one of your specialties. Just the things that typical 26-year-olds don't go through, that you can't talk to your friends about. You can, and you can lean on them for support. But the Breasties is meant to be your best friend. And so it's a combination of the word breast and best friend. So it's the Breasties. So kind of like your play on the Girlfriend Doctor. I mean, it's just a community where you can go to and never have to feel like you're being judged or that you're the only one that's been through something like that. So I've really enjoyed being a part of that. So
that's amazing. I was so excited to hear about this organization because I think that's where you have community, there's healing.
Yes.
And so you're finding out that you're not alone. Well, tell us a little bit about your story, Sierra, because so young to be diagnosed with breast cancer.
Yes. So I was 24 at my initial diagnosis. I'm a registered nurse, like you mentioned. I moved here to Dallas when I first became a nurse. And I thought by the time I moved here, got settled in with my boyfriend, we were high school sweethearts. I thought it was time to kind of put my own health as a priority. And I knew that my family had been affected by cancer early on. So my aunts both had breast and reproductive cancer. And then I had a cousin who was 29 years old that was diagnosed with breast cancer as well, as she was about to turn 30 and starting her family. And so then I kind of knew that cancer is in my family, but there's always kind of like a misconception, cancer just loves your family, or it's something, like maybe where you live and things like that. And so I kind of looked into a little bit more. My family discovered that we have the BRCA1 gene mutation. And so I went and got tested. My results came back positive. And so immediately the typical protocols to start screening. I technically should have started, I think, at 19, 10 years before your youngest relative.
With MRI?
Yes.
With a periodic MRI, not mammogram, because we're not going to see with the dense breast tissue.
Correct.
Right?
Yes.
And let's talk about BRCA, just so BRCA1 and BRCA2 genetic mutation is when you have that genetic mutation, that's the familial breast cancer, can also be associated with colon cancer and ovarian. But when we have that gene, you're at actually an 80% increased risk over the general population to have a diagnosis, a lifetime diagnosis of breast cancer. Is that correct?
Yes, that's correct. And so a lot of the Breasties community are people who choose to have preventative double mastectomies. They feel empowered by that decision. So that was a decision that I was initially posed with. When I initially met with a genetic counselor, which is typically the process after you're diagnosed with the BRCA1 genetic mutation, is they meet with you, they talk to you about the options, give you the option of having a hysterectomy at such a young age. And those are a lot of things to consider when you haven't even, decided if you want to start a family yet. So, but that's a lot of what, it is being empowered by your decisions and your health and being able to kind of take it into your own hands. So those were the decisions I was trying to make. And then when I got the results back from my screening, the decisions were kind of, taken away in a sense. And so, but I still feel like I got to make those decisions. I went through fertility preservation. So I did 2 rounds of that.
So that's also like egg preservation. So you had
yes.
You have cryotherapy for the eggs. Yeah.
Yes. So that was a big decision to make. I mean, it was my first procedure that I'd ever had. So it was a lot.
At what age were you diagnosed?
24 years old.
24. And so in order to do that, just for our audience, you're injected with high levels of hormone.
Yes.
And here you have this breast cancer diagnosis and we're injecting with high levels of hormone so that we can, essentially retrieve eggs from your ovaries and save them for when you're ready for them.
Yes. And since my breast cancer was triple negative, meaning that it does not respond to any of the hormone receptors, my oncologist didn't feel like that was that much of a risk, but I was given a timeline. So I was diagnosed in November of 2018, and by the end of the year, it was, we need to start chemotherapy. So the timeline was a little skewed, but I started January 4th. So we got to go celebrate New Year's and, say, this is going to be a good year. We're going to, move on from this. So we did that. And then I had, after the fertility preservation, which sometimes is a diagnosis in itself, infertility, I then started, I did 16 rounds of chemotherapy. So I did adriamycin, they call it the red devil. So it's infusing in red. And then I had Cytoxin, Taxol. My oncologist also added in carboplatin. So it was just kind of all of these things. And then I met also with a dietitian beforehand to see what you could do, to completely maximize the effects of these medications and make sure that also you're, putting your health first, and see what you can do there. And so I met with them. And then I underwent a double mastectomy, and I had tissue expanders in place. And then after my surgical pathology, I initially was diagnosed in my right breast, and it moved cross-lymphatic into my left-sided lymph nodes while I was undergoing all this grueling chemotherapy.
Goodness,
So then I started radiation treatments. Those were daily, so 33 rounds of radiation.
Radiation locally to chest and
and then also the axilla, and then the upper clavicle lymph nodes as well. And then so I had that. You have to hold your breath, and it's it was like a therapy in a way. You get to sit there with your thoughts for 30 minutes a day, and so it was a lot just going every day for daily appointments, but made it through that, and then had the final round of my reconstruction surgery. So it's kind of nice. They do it with a plastic surgeon. They do fat grafting, which is essentially, one positive thing I feel like I got out of it was liposuction at the time of the reconstruction surgery, if there's a positive way to look at it. But so that, and then I ended up doing 6 months of an oral chemotherapy. My oncologist really felt like it would help to reduce my risk of reoccurrence. So I finished that in June of this year, and here I am.
And here you are, looking healthy and radiant and beautiful. And what were some of the physical consequences of the chemotherapy and radiation experience?
So mainly I feel like, I was, blessed enough to not have to experience nausea. They give a lot of antiemetics before, anti-nausea medications. So I always had, and they give steroids, so I always had a really increased appetite afterwards. I know with the chemotherapy treatments, a lot of people get nauseous, and so they're not able to eat. And my main thing was I gained weight, but then I also lost a lot of muscle. And then your hormones are affected. I was thrown into menopause at 24 years old, right immediately after I completed the fertility treatments. And so, there's a lot of things that you aren't able to speak to your regular doctors about. They're kind of mentioned at the very last or given to you in paperwork, about your sexual health, your mental health. And, those things are all something that are important to your overall health. And I just feel like it wasn't the first thing that we talked about. Obviously we want to make sure that someone's healthy physically and, based on their surgical results and everything, but those things are also important factors that sometimes are overlooked in cancer care.
Now, have you started your periods back?
I have, yes. So 2 months ago I did. So yes, yeah, yes. So
Let's celebrate.
Yeah. So 2 months ago, started using organic tampons since then, and so just things like that to try to help. I know it's really big having a breast cancer diagnosis to use like non-toxic products, all natural. So just trying to make changes like that. But yeah, so I did, and it was kind of a shock. I'm like, okay, I'm 26, I'm having a menstrual cycle, but like, what do I do now? So it was different, but it's something that I'm thankful for, and hopefully it just means that in different ways I'm able to kind of move on. And so yeah.
And Sierra, you said you had your high school sweetheart and you've been together, you told me before we started recording, for 10 years. Now, how has this experience grown you as a woman and in relationship, and how has that affected you?
It's been difficult, but it's empowered me to be my own person. I'm currently enrolled in school to be a nurse practitioner. So it, kind of gave me, prior to diagnosis, I was already leaning that direction, but it gave me, even more empowerment to be able to make that decision for myself and move forward to be able to help others. As a woman, it made me realize, being with my boyfriend for so long, I need him, but I also need myself, and I need to be myself. We got a dog after my diagnosis, so I think we both kind of needed that and a change. But it's just really, as a woman, it kind of makes you, a lot of times it makes you feel weak. And I think one of the strengths that you can display from this is saying that you feel weak at times and you feel defeated at times. But that's why, and he's been great through all of this. I couldn't have asked for anything more from my support from him and my family and friends. That it's where kind of the space was filled in by the breasties, that they really just get it. And you don't even have to say anything. Like, they just sit there and you just listen. And they do what's called a circle time. So kind of like this, but on a larger scale. And they just listen and they just get it. And so you don't have to feel like anything that you've gone through is that you're alone in it. Even if they weren't there, they get it and they know. And so it's been really great to have them. And so I think that it's something that's important for anyone that's been affected by breast or reproductive cancer to know that they're here. It's a social media outlet that you can go to. They're here to support you. They offer grants annually for those affected by breast and reproductive cancer. Anyone can be a breastie. We hope that you, Dr. Anna, will become a breastie.
Absolutely. Absolutely.
And so
there's so much we're going to do together, Sierra. There really is.
Yeah.
I know that this is an incredible mission. I think what I feel so strongly is that this, often we have to put on a brave face. Often we have to put on a brave face, like, okay, well, gosh, we've worked through this and now things are rosy. And that's not how life deals us.
Yeah. No, it's definitely not linear. It hasn't been. And I think it's kind of like, where do you go from here? A lot of times with things like that, you just, feel numb. And there's things like I was lucky enough to have great, providers throughout my care, and a great primary doctor and gynecologist, I felt like, and then even meeting with the oncology gynecologist for follow-up care for my BRCA1 risk with ovarian cancer. But and I feel like they've touched on things like that, but it's been difficult to go through something like this. I know you work with a lot of women through menopause and things like that, but probably at a much older age. So it's just, it's a lot to have to go through. And, aside from it's just kind of picking up, like you said, finding the strength to do that. And so,
building a strong enough foundation so that you're not waiting for the next shoe to drop.
Right.
Which is something my breast cancer patients would always say. It's like, when's the next shoe? When's the next diagnosis? Or, if it's right breast, when's the left breast? And those challenges that we have. And always I'm glad you're going into to be a nurse practitioner, continuing your study in medicine, because getting to those root causes, it's beyond, we have the genetic expression, and then we can use environment, nature to overpower that genetic expression. I just one more question for you. So is there a question that you had like in your heart that you said, gosh, I need an answer to this, but I'm afraid to ask. I don't know what to ask. And, I'm struggling. I know my breastie sisters are struggling with. What is that?
So I would say the question that I would have asked would be, had I have known, say, 6 months before I was diagnosed, what can I do? What can I do to completely optimize my health, to make sure that I have kind of like can use my body as a machine going into this and work with my body as opposed to working against it. What can I do to kind of armor myself to fully be prepared for what's about to happen? Because before, and I'm sure a lot of the other breasties feel this way, before you go into treatment, you're healthy. Sometimes, a lot of times people go in because they have a lump or, they suspect something or they have something or symptoms, but oftentimes, especially at such a young age, you have no symptoms. I had two clinical breast exams before I was diagnosed, and nothing was found because the breast tissue is so dense at that age. So I think my main question would just be, what could I have done to try to help best prepare myself for the journey that I was about to go on.
And it's like, what are the steps? It's never too early to start. So I think like we teach that. I really feel strongly in working with patients too. It's that concept of what decreases our risk moving forward, and what do we need to do now? And that's the concept, intermittent fasting. I call it keto-green living, keto alkaline, right? Just avoiding sugars. And Mary, a mutual friend of ours, was saying that what you brought up, it's a misconception by the media that it's weight loss with chemotherapy, because it's steroids and nausea and can be many things, and weight gain. And then that's another thing on top that we have to deal with body image wise as well. And so like the support, having support around that and to be able to talk through this is really important. I think breasties do this really, really well.
Yes.
So I'm so glad. I'm glad you're here. We're going to have more conversations and address these issues. And I'm glad you guys are doing this. So for our audience, the Breasties is this nonprofit organization. It's at thebreasties.org. And it is, check it out, refer to friends, and let people know about this organization, just supporting sisters through this journey. And I thank you. I thank you, Sierra, for being here today with me. I want to encourage all of you to check out thebreasties.org and donate. It's an amazing organization doing so much good. Sierra, tell us a little bit about some of the things they are doing.
Yes. So the Breasties, like Dr. Anna mentioned, it's a nonprofit. They offer annual grants to those affected by cancer, breast and reproductive cancers. They, prior to the pandemic, were able to offer in-person weekend wellness retreats, where someone who had just undergone a diagnosis or treatment could go and really just feel like so inclusive, that they belong, they were not alone, and that even what they had just gone through, that they were able to sit there in that time and have that time to themselves and with others who understand it. They also do an annual gala, which they have, in a Camp Breastie, where, they had hosted over 500 people who had been diagnosed or affected in some way by breast or reproductive cancer. So, any donations that they get go to that. And even throughout the pandemic, they've been able to offer just immense virtual support, which takes a lot of resources, a lot of time. And, it's where you have to kind of focus on yourself first, because you can't give from, an empty cup. So, they've just done so much to help the community, the cancer community. And so in order to help their cause, you can text Breasties. So again, we talked about it's best friend and Breasties. So you can text Breasties to 44321 to donate to their cause.
So text Breasties to 44321 and donate. What a great organization. Thank you. I think there's a lot we're going to do together.
Yes. Yeah.
There's
Thank
a
you
lot
so
that
much.
we're going to do. Thank you. Stay tuned. We'll be right back. Welcome back, everyone. Now we're going to switch to talking about implants and explants. And today my guest is Dr. Rachel Walker. She is a Dallas plastic surgeon and owner of the Plastic Surgery Center of Dallas. Welcome, Rachel.
Thank you so much for having me.
Well, I'm so glad to talk about this. We've been dealing in October with breast health, breast cancer awareness, and there's a lot of discussion of, just the physical appearance. How do we do after breast surgery? If it was mastectomy or if it was for breast biopsy, or in general, if we're postpartum mom and we've got droopy breast and, you know, not really sure. So I wanted to talk with you about implants and then also bring up this really important discussion about explants.
Yes. I think they're all great topics. And the nice thing is everyone has countless options when it comes to their breast, be enlarging them, lifting them, choosing an implant if that's right for them, using fat to modify them, or if they have an implant and they're not feeling great, taking that implant out.
Yeah. So when you talk about using fat to modify them.
Yes.
Tell us about that.
I think fat is a great option because you're using fat that's already in your body, and everyone has some fat they want to get rid of somewhere.
Oh, yeah.
And then enhancing the breast shape. What it can't do is it can't increase. You can't take someone from an A cup to a D cup. You can add some subtle fullness. It's great for breast cancer deformities. If someone has a lumpectomy and has a little divot remaining, fat is a great option there because maybe someone doesn't want an implant. It often is also used with lifts because people who have stretch in their breast over time, a lot of times they lose a lot of the upper pole fullness of their breast and they don't want an implant, but they still want some roundness there so they can fit in bras and shirts better. Fat is a great option for that. I just think it's important that patients have realistic expectations. So it might be 2 to 3 sessions of fat grafting to help them reach their goals, but if it is a subtle thing like a divot or just a little roundness, that can be done in one session.
Oh, that sounds awesome.
Yeah.
And there's a lot of fear around implants now.
Yes.
A lot of discussion about, you know, the syndrome associated with breast implants. And
Yes.
I want to bring that up because it's a real concern. And
Yes.
how do you know? Well, first, let's stop. Let's backtrack a second. Let's talk about, you know, how implants have changed over the years. They're not the same as they were 20 years ago.
Correct.
And that they are safer.
Right. So breast implants back in the 70s had no regulation around them. The FDA didn't regulate these implantable devices. And then breast implants kind of got grandfathered in once the FDA started regulating them. Well, then in 92, people started looking at breast implants more, and breast implant companies couldn't say that implants were safe. There was no proof that they weren't safe, but they ended up in the 90s withdrawing implants off the market for cosmetic purposes. Gel implants were still used in breast cancer patients for reconstruction, but they weren't able to be used in a breast augmentation patient. And that allowed these implant companies to do a whole bunch of studies, like is there a higher risk of autoimmune disorders or any type of disorder with the implant? Ultimately, these studies came back and showed that breast implants had no correlation with autoimmune disease, and they were put back in the market in 2006. And ever since, they've been trying to keep up with the science and make tracking higher level. And things have been going great, but then breast implant illness came up. And there's a lot of women out there who have these really nebulous constellation of symptoms: fatigue, hair loss, low energy levels, sleeplessness, too much sleep. They're not feeling like themselves, and they have breast implants. And so right now, the plastic surgery societies are really trying to work on finding good data. Are there things that make people more susceptible? Is it a genetic marker? Is it something in their health history that maybe we could have picked up on and said, you're at higher risk of breast implant illness? Because if you look at most of the data, 95 to 98% of people with implants are healthy, happy with their choice. And if they choose to get them removed, it might just be that they want smaller breast. But then there's still a huge chunk of women out there that don't feel good. And we need to find out why and what markers there are. Because unfortunately right now, if you look at blood tests, they're stone cold normal. Their x-rays are normal. All these lab studies are normal, which I can only imagine is incredibly frustrating for the patient.
Is there an increase in Hashimoto's or autoimmune disease in these clients that have these symptoms?
If there's not a good study that shows that, so there is a study that shows no, people with breast implants don't get diagnosed at a higher rate of Hashimoto's, but now we're trying to work from a different level and look, the patients who get implants who have Hashimoto's, or maybe they have something else going on in their health history that could have set an alarm off for us. Maybe the breast implants aren't right for you. Maybe it will tip your inflammatory mechanisms in your body to a level you can't tolerate anymore. That is kind of where the research is going, I think. Not that the implant causes the Hashimoto's, but maybe it makes your genetic susceptibility tip a little bit, and then your Hashimoto's comes out because you were more susceptible than someone else.
Yeah.
But they're doing a whole implant registry now so they can track and bring back patients. And luckily patients are very willing to be part of the registry and have these symptoms tracked because we want to know, like, are there people that just aren't right for implants?
Right. I think that's important. And also just looking at the toxicity level, like if we can see phthalates in the blood, for instance, plastics or PCBs or whatever it may be, if we can start tracking that in the blood or the urine,
Right.
and then we can see, okay, how is this increasing over time, maybe baseline and then periodic, that may be a nice thing to add into the studies.
Right. And there is a very smart plastic surgeon out of St. Louis, Patricia McGuire.
Yeah.
And she has really made this her baby, tracking all of these things. And she's very tight with people in the breast implant illness community because those are the things we want to know about. But I don't think at this point anyone in the plastics world really thinks that it's one, like everybody gets higher levels of X if you get breast implants. But there are probably certain markers in a certain patient that they can't tolerate a foreign body in their body, or maybe their body is more sensitive, or maybe they had a higher level and we've just pushed them over. But it's going to be very interesting when the study's completed.
Yeah, and I'm curious too, because you think, okay, well, what would create a leaching of the plastics, right? And then I think from my perspective, it's that that acidity, like having high inflammation, high stress.
Right.
And is that a part of it? And these are just things we just don't know.
Right. And I think that's why I was so interested in coming on your podcast, actually, because I think all your work is fantastic.
Thank you.
And I think people look at health really one-dimensionally a lot of times, but there's a lot of things that need to be done to have a healthy body, have healthy balance of things. And we'll meet these patients who have had breast implants for 15 years and they felt fine, and then all of a sudden they started feeling sick. But maybe something tipped them over. Maybe they're getting chemicals in other part of their diet or cosmetics they use or hair products they use, and then the implants just aren't helping things anymore, and the implants get taken out and they feel better. But unfortunately right now we don't have enough research to always promise somebody. I can't tell them your implant's going to come out and you're going to feel great.
So let's talk about cosmetically, and too, like no shame in like saying our breasts are part of our femininity. We want to own, okay, the way they are. That's amazing. I have 4 daughters. So, at all ages right now. And so I always get the questions, Mom, are mine different? Mine are different than others. One's different than the other. My daughters are going to kill me right now. Like what do we do about this? I'm like, just wait it out.
Yes.
Wait, stay healthy. Let's work on these things and you'll see it'll even out over time. And I think we had a beautiful lady, Dana Donofree from Anna Ono, who does the bras and just like non-binding bras, and even for women who have had implants and mastectomies. So I think that's there's such a I would say image issue sometimes when you're dealing with the concept of inserting breast implants or having reductions. And so what type of counseling goes around that?
I think it's really important that the patient is clear about their goals and is reminded that everybody's different. Everybody looks different. And breasts are sisters, not twins. There is no one who has 2 twin breasts.
I like that.
And I think people get wound up in their own asymmetries and tend to just really focus in on something because they see their own body every day. And I always like to reassure my patients, like, you are normal. Because everyone is normal. There are people who have congenital disorders where one breast is tremendously bigger than the other and they can't wear bras, or people who have really large breasts and they get chest, back, and neck pain. And then there's, the garden variety breast augmentation patient who just wants to look different in clothes. I feel great doing that augmentation because they have made this decision. They don't feel bad about themselves. They just made a conscious decision to change something about their body. It's their body. They get to do something with it. But I get nervous when patients come in and they say, like, I feel abnormal, or I feel like I would be better if this change was made, because I feel like there's usually something else going on there, or they're just being too hard on themselves. But I see hundreds of breasts a month. And they come in all shapes and sizes, and they're all glorious.
All beautiful, exactly. I'm with you. All beautiful, and I think it's important to embrace that, that just really to accept that, because often, and you've seen it too, if it's the breast, and then it's the abdomen, and then it's the neck, it's the it's ankles. Just one thing after the other, and that's a challenge. And
I know. I think one of my favorite phrases were that stretch marks are tiger stripes. You earn them. There's so many people that beat up on themselves for things that happen with aging. Gravity works, aging happens. It's great to get older. But if you want to make well thought out decisions to change your appearance, more power to you. But I don't think you should sit there looking in the mirror just feeling bad because someone else has a better neck. Well, maybe you have better kneecaps.
There you go. There
you don't know.
Yeah. I think like one of the programs I have is called Sexual CPR. And I say the ABCs of sexual CPR, like you have ABCs of CPR.
Yeah.
So it's like accept yourself.
Yes.
Accept where you are right now. Like to feel sexy, just accepting all your uniqueness, right?
Yes.
Your imperfections, perfectly imperfect. And that's a really big one. The B is be present.
Yeah.
And then C is communicate. So I think it's too like saying, hey, you know, what we had on just before you came on, Sierra from the Breasties, and the concept of communicating with others. You're like, you're not alone.
Yes.
You're not alone. And I love the comment, look, your breasts are sisters, not identical twins.
Yes, they are not.
I love that. I love that.
Yeah.
And so where do you feel like there's that line, like someone is, you know, there's that person who is on that threshold. You're not sure, like this is the right decision for them. How do you counsel and coach?
So for me, it's important to have a long initial consultation with my patient. I don't believe in meeting my patient the day of surgery or anything like that because I want to hear about their goals because everyone's idea of beauty is different for one reason. And two, they need to have realistic expectations. So one 25-year-old could walk in my door and only need a breast augmentation to help her reach her goals and she'll be happy. The next 25-year-old could walk into my door and maybe she needs a breast lift, even though she's never had kids, but she wants something changed with her breast, but she's not really sure how to get there. So that's important. And then someone else might just be unhappy because they're unhappy about something else in their life and they think it's because of their breast and they just really haven't dove deep. ASPS, one of the plastic surgery societies, just released a questionnaire that's kind of trying to help people really mentally think about breast augmentation more. Because I think there's a lot of people out there who just don't think cosmetic surgery is surgery, but it is surgery. You're going to sleep and you're making a surgical modification to your body. And breast augmentation is quick and generally like you can get it scheduled pretty quick. So I think some people look at it kind of like Botox, even though it's very different. And so if you make them sit down with a 6-page questionnaire about your goals and like these are the risks of breast surgery or these are the potential hurdles you might have to jump over or in 15 years you might have to have them replaced. It makes it a more informed decision by the patient and I think just helps with the overall recovery process and selecting the right patient.
So you mentioned having them replaced. So let's talk about this because this is one of those issues that like, oh my gosh, once you have them in, you never want to replace them or if you're going to have them out, just get them out. And then what does that look like if you don't choose to replace them?
So implants, there's this huge myth out there and I don't know why it's still perpetuated that you have to get your implants replaced every 10 years. That's not true. But what is true is your implant warranty lasts 10 years. So if you had a rupture prior to 10 years, most implant companies will pay for part of your surgery and get you new implants. After 10 years, if your implants are just fine, keep them. And just check in with your plastic surgeon regularly. The FDA now recommends every 3 years getting an ultrasound to make sure your shell's intact, which is nice because up until a month ago, they recommended MRI, which was kind of difficult for patients to get. It was cost prohibitive. The nice thing for me is if you think about 15 years, your implant should last you 15 years. You're going to be a little different place in your life. Maybe you want to go bigger. Maybe you want them out, which is a great question. What happens when I get them out? If you pick an implant that fits your body size, which is different for everybody, what an 800cc implant looks like on me versus someone who's 6'2" is very different. Versus an 800 on a 5'1" person probably won't fit. But if you pick something body appropriate, the aging of the breast is not going to change that much. And so presuming your breast ages well, which everybody's different, your breast is going to look pretty good with an implant out. It's just not going to be as full. But that's why push-up bras are made if you want to change that.
There you go. So removing the implant can still
you can still have a beautiful breast. I think mentally it can be tough in the first 2 weeks because there's some little divots and sometimes the breast will suck up a little bit and it will look a little deformed. But over time, that skin tissue envelope will shrink back up, kind of like a pregnant belly. And then the breast tissue will fluff out a little bit because over time with compression on the breast tissue, it does get a little compressed. And once you take that implant out, it will fluff back out. So people are generally pretty surprised how pretty their breasts are. And that's assuming you liked your breasts before augmentation, you just wanted them bigger. But if you have some of the other aging problems, like maybe you had a couple pregnancies with your implants and your breasts drooped a lot and fell off your implant, you're probably going to need something else if you want them up in a normal posture.
More of a lift with
more of a
that in.
lift. And it's still a pretty breast remaining. It is very rare someone needs an implant to have a classically pretty breast, but
I'm glad to hear that.
Yeah.
That's great. That is good. And then if a woman does want to have her, like if she's worried about breast implant syndrome,
yes.
what should she do?
So I think meeting with a plastic surgeon is first and foremost, like get that conversation started, because I think it's mentally stressful for one thinking something inside your body is poisoning you. And that's not like, that's something we need to start the conversation with. And maybe you are the person who cannot tolerate a foreign body and you need it out. And so the plastic surgeon is going to be the one taking it out. But I think it's also important to not be short-sighted. We don't want to miss something else. We don't want to miss like a parathyroid problem just because there is a breast implant and there's a lot of social media excitement around breast implant illness, that I think for me, the biggest fear is someone missing something more important because they want it to be their breast implant. But the nice thing is if you take a breast implant out, like it doesn't affect you much. I mean, it is like if I felt sick and I had a breast implant and I couldn't figure out what's wrong, I'd try taking my breast implant out. It's a very definable step. But I think it's just important to have the conversation, make sure your other health is in line. Like, is your diet okay? Are you getting good sleep? Do you have anything else going on in your life? Because it could be multifactorial. And we don't want to just hone in too much on one thing.
You've done a number of explant surgeries too. And do you feel like, have you seen anything like mold issues or finding a rupture, like surprises when you've done it?
I've never found mold. I found problems with the capsule. So that's just the scar your body forms around the implant that can get thick. And it can get thick from a variety of reasons. So maybe there was an infection at some point and your scar tissue just overformed. And that I think can cause inflammation because it's thick and it kind of tugs on your breast tissue. And taking that capsule out might relieve some of that.
Lymphatic flow, right?
Yes.
So for the lymphatics.
Yes. And then those ruptured implants, oftentimes I'll go in and find a ruptured implant that I didn't necessarily know was ruptured, but the patient wanted to change them out anyways or take them out. So we didn't have to get any further studies. I do think having a ruptured implant changes how your capsule reacts around the implant, because the shape of the implant will change over several years, and that might trigger more inflammation. It might trigger some kind of change in your body. So getting that out is best. I think patients who I put an implant back in and maybe they had breast pain as their original complaint, they tend to feel better, but also patients who just want them out, hopefully they feel better.
And so, I mean, such a good point. So if someone's wondering, should they go for a breast ultrasound to look? And would you be able to see a capsular rupture mostly on a breast ultrasound?
Most of the time, there are limitations, which the nice thing is like ultrasound technology has improved so much over the past decade that they are really seeing most ruptures with an ultrasound. If it's inconclusive, you still might end up in an MRI. But if it's important, that makes sense. But a screening MRI every 3 years was not very feasible for most people. So if you could do a screening ultrasound every 3 years, and you can see most quadrants of the breast implant, except in people with very large breasts to begin with, who just wanted to make them larger. It's hard to see through all of that. Mammograms also will pick them up sometimes. It's not a good screening modality for rupture, but I mean, I have a lot of patients who come in, their mammogram told them they had a rupture.
Yeah, exactly. All right. So I want to thank you so much for spending time today. I do have one more question for you. So what is your favorite plastic surgery procedure to perform?
I don't even know if I have a favorite right now, because I went into plastics because you get to do so much. And it's just so fun to partner with a patient on a journey. And I feel like my favorite is just getting to know the patient long term. So you meet them and join them on this journey for maybe subtle tweaks they want to make, or just to get to know them. But I love mommy makeovers. I just think it's a fun journey to be on with a patient, and that's a little more straightforward and why patients come in for it, but it's all fun.
It's all fun.
Yeah.
Well, you're lovely. You're lovely. I'd like you to be my plastic surgeon. So much fun. So Dr. Rachel Walker from Dallas Plastic Surgery Center right here in Dallas. So really a pleasure. Thank you for sharing your information and time with us today.
It was a pleasure.
Well, we will be right back. Well, I'm back in the hot seat to readdress this question about implant, explant. And I know we dove deep into discussion here, and it may leave you with even more questions. And this is where it's important to understand what is happening with your body using your intuition and being very proactive in your health. You're putting your best health and self-care as a priority in your life. This is critically important. And whether you've had implants or not, whether you've had a diagnosis of breast cancer or not, you have a family history, all of us have to keep the healthiest temple of our spirit that we absolutely can. And it starts from the ground up. And if you have questions, you know where to ask, right? I am here for you. So don't hesitate. Visit me, at dranna.com, my website. On my show page, there's a place where you can type in a question and we can dig even deeper. At my dranna.com, the show notes for this episode are there with the resources and links to the Breasties, to Dr. Rachel and Dr. Kyrin, and additional resources for you as well. So remember, I am here for you. It is about embracing your whole health, right? Nourishing your body, awakening to what is possible for you, and shining from the inside out, and embracing your health, embracing loving relationships and connection. Those are the 4 pillars here at the Girlfriend Doctor that we build the foundation of whole health on. And remember, when you have your health, you have 1,000,000 wishes. And when you don't have your health, you only have 1 wish, right? To have your health. So I want that for all of you. And as we enter this season of gratitude and giving, I want you to know that you are not alone. We're walking this journey together, and I am here for you. Until next time, see you soon.